So statistics tell us that 1 in 3 will get cancer during their lifetime in this room. Okay? And of those cancers, a large proportion will be colon cancer. Colon cancer is currently responsible for 694,000 deaths annually in the world. So to put that in perspective, because that's a big number, think of 4 fully loaded jumbo jets going down on a daily basis. Okay? That's much worse than the war on terror. In the United States, it's the second leading cause of cancer deaths. So how can we tackle this problem? Early detection is key. As you can see from this graph, if it's detected at the first stages, the prognosis is very good. There's more than 92% of a successful way of dealing with it. If you leave it late, it's 1 in 10 chance of surviving. The current methodology for dealing with this is colonoscopy. However, nobody likes colonoscopy for a number of reasons. That is shown from a study from the Mayo Clinic in the United States. It could be the laxative preparation, the idea of the insertion of the endoscope, and so on. So what has AGI Medicaps done to help this? Okay? So we've developed a fluorescent dye, which when injected in this mouse that looks okay from the outside, you see that there's got 2 major tumors in that mouse. And we can see these tumors even below healthy cells. So we can see through healthy cells and see the cancer developing at the first stages. We've also developed a pill, which is a fluorometer, which when ingested and it goes through the intestine, can look for that fluorescence. So how would this work? You go for your annual checkup. You have the fluorescent dye injected into your system. That goes to the cancerous cells. You swallow a pill. That pill goes through the intestine and starts to detect fluorescence. As the pill is passed out, you have your phone in close proximity, and it uploads the data to your doctor. The doctor will see a very simplified graph, and if it's flat, he'll congratulate you and tell you come again next year. If he catches a few spikes there, he'll look into it further, and hopefully it will be very early so you can benefit from the 92% of the prognosis. So looking at the competitors is quite a crowded space. The first case of colonoscopy we talked about. Then there's the stool tests, which are uncomfortable with dealing with stools and they're not very accurate. There's a pill cam, which basically takes a video of your intestine. The doctor has to look at that, and for that to work, you need to have a very extensive laxative preparation, so the bowels are very clean, so nothing sticks on the camera. There's also the CT scanner for a virtual colonoscopy. Again, you need to take the prepping, and also you get exposed to ionizing radiation, which is something that you don't want to do on an annual basis. There's a new product that will be coming out soon, CheckUp. That's basically a CT scanner in a pill. Again, it exposes you to radioactive substances and ionizing radiation. And then, of course, there's our product that should come out at some point, which doesn't have all these problems. In order to make things easy to digest, we've made a graph here, and we can highlight some of the key features of what we have. So we can scan both the small bowel and the large intestine, which some of the other solutions can't. We don't have ionizing radiation. You don't need prepping. It's simple and comfortable, and you can avoid anesthesia, which is used for colonoscopy in most countries. And in terms of the price, it's very competitively priced. It's much cheaper than a colonoscopy in the United States. So how are we protecting our technology? Well, it's a combination, a triple-pronged approach, and that includes trade secrets, how we do things. There's large barriers to entry because of the cross-disciplinary aspect of the product, pharmaceutical, optoelectronics, electronics, medicine, and so on. And we're also filing some patents later this year to protect some of the parts that could be copied. The founders and team leaders are all recognized academics with a global reach around the world with a very broad network. And they cover all the 3 major areas that we need to cover for this product, which is the gastroenterology side, the electronics, and also the fluorescent dye side. So our plan is to develop 3 stages for a GI cancer platform, and that covers screening, diagnosis, and treatment. At this stage, we're focusing on the screening. So by 2022, we want to get these devices into some flagship hospitals, and then by 2023, distribute to a wider network of hospitals in order to get to the patients. So let's look at the market. So our beachhead market is the United States. There's 107 million people who qualified for colonoscopy. That's the over 50 range. We could broaden that, but we're keeping focused at this point. About 90% are covered by health insurance. And then we want to narrow this down, people that use a smartphone who are really concerned about their health and get annual checkups and so on. So if we say that about 10 million people will come once every 2 years for this test, and we make $100 profit per test, we're talking about $500 million profit. And if we expand to other countries, this gets bigger. We've invested about 10 years of development of the technology for what we have. We estimate that at being about 2 million. We're looking for 3 million in order to hire an experienced CO with medical device industry experience. And then we need to further develop our markers and capsule so it's ready to pass the FDA approval and have our first in-human trials by the mid-2020. After that, we expect to raise about 5 million euros, conduct clinical trials, and get the FDA approval at that stage, and then scale our production. So by 2022, we can really distribute our product in a scalable way. So if there's something you need to remember from this pitch, is that if you invest in AJM Medicaps, not only will you save lives, but you also make quite a bit of money. Thank you for listening.